My name's Helen Bygrave. I'm a GP normally working in North London, and this is my third mission for MSF now. I'm now here in Lesotho, which is a little country surrounded by South Africa. The plan is for this morning is for us to go out to one of our clinics with the mobile MSF team and see what's going on at one of the rural health centres. Normal morning, trying to get going, getting everybody in the car is the most difficult bit of the day. We've been working here in Lesotho for 2 years and came here because Lesotho has the third highest HIV rates in the world. About 1 in 4 people here have HIV, so there's a huge need. And one of the problems we saw when we came here is that all the HIV care was being given at the hospitals. So people living in rural areas, many people living 3-4 hours walk up a mountain from the local clinic, just couldn't get to the hospital to get treatment. So what we wanted to try and do is take the treatment to them, so patients never have to come to the hospital and they never have to see a doctor. It's all done by nurses. We've actually got a new nurse working at St Barnabas Clinic today. Ndate, what's her name? Ndate James, well that's an easy one. Ndate James. So he's going to sit with our nurse Patricia, who's been working with us for several months, to see how she takes a history from the patient and looks at how to follow up the patient, and then hopefully after a few patients we'll swap over so that Ndate James starts seeing them and we'll sit and advise him and make sure everything's going to plan. The other problem that we saw is that here in Lesotho, as in a lot of other southern African countries, there are very few doctors. There are also very few nurses, but here there's about 7 doctors for every 100,000 people. At home in my GP surgery, I have a list of just over 2,000 patients, so you can see the huge difference. The other thing we've done over the last 2 years is train a team of nurses that work in the primary healthcare clinics, and then also a team of, we call them lay counsellors. They're actually people who have been treated and have then been trained to be counsellors to be able to start people on ART out in the clinics. We're leaving here, Maria's coming, we're going, and this afternoon we've got the medical team meeting and a bit of kind of admin, drug ordering to do this afternoon. So that's it. Lots of people, or lots of my friends at home kind of ask why I've left my GP practice in London to come and work with MSF the last couple of years. It might sound really corny, but you work very hard, but it is incredibly satisfying, and the relatively small interventions we make a huge difference for the communities that come to our clinics and to the hospitals that we help support. I've also learnt a lot actually. I learnt a lot about HIV and TB that I didn't know 2 years ago, which has been great, and the medical work is really interesting. One of the best bits is working with the national staff, who have been great in all the projects I've worked in so far, and also meeting some interesting and really good fun expats from all over the place. And also I think this project is quite special because it is a nurse-led project, which still isn't that common in African countries, and certainly not outside Africa. And I think that's a real challenge to make that work. There's such a huge human resource crisis here that we have to make it work if people are going to get treatment. So yeah, so we'll see how the next year goes, and yeah, see whether I do another trip with MSF somewhere else.